And now we take a look at the myths and facts of COVID-19. Joining us in the studio is Dr. Lakunle Iroja. He's a respiratory physician. Thank you for joining us.
My pleasure.
We also have Dr. Esten Ukorobi, a GP registrar, Royal Hospital England, a frontline staff in accident and emergency. He joins us via Skype. Thank you for joining us.
Thank you very much.
All right. Perhaps let's begin with you, Dr. Ukorobi. And this is looking at what the Mirror is reporting, that over 40,000 deaths from coronavirus. Would you say that are things getting better? I mean, after passing the peak, or are they getting worse?
At this point, we have about 32,000 deaths in the United Kingdom. And generally, I would say that things look brighter, things are getting better. So we've seen day by day the number of deaths due to coronavirus reduce. So yesterday we had one of the lowest accounts, our numbers of deaths in the United Kingdom in a lot of weeks. So we had 210 persons die yesterday, which is one of the lowest figures that we have seen in a very long time, as well as the number of new infections. So we can see that, yes, things are getting better in the United Kingdom.
Experience as a frontline worker, we understand that psychological impact of the virus is rising, especially among health workers.
Yeah, that's completely true. So we have seen an increase in the psychological impact of COVID-19 amongst health workers and even non-health workers. So we have moved from the usual cases that we see normally in the front line to seeing more of mental health cases. So people come in with alcohol intoxication, people come in with depression, people come in with suicide attempts and things like that. And we have also seen, this rising even, among the healthcare workers, because I mean, coronavirus affects everyone, but most importantly, the healthcare workers who look after these patients and put their lives at risk. So yes, we have seen quite a lot of psychological impact.
Let's come to Dr. Roger here in Lagos, respiratory physician. How do you think we've been handling our COVID-19 response since the coronavirus attacks the respiratory system?
Well, the problem with this novel coronavirus is that everywhere in the world, everybody's still kind of feeling their way around it. There's nobody that has a perfect response, more especially here in Nigeria. We have our government trying to do their best, but there's a lot to be desired, both in terms of case finding and treatment. Treatment, like I said, nowhere in the world has any effective treatment been discovered. So everybody's just trying one thing or the other. Case finding is a bit difficult because, as you're aware, we don't produce our own testing kits, so there's a limit to the amount of testing kits that are available. With regards the modalities they put in place to try and control disease, they've done their best, but it seems to me that while the government is working on the one hand, people in general aren't really working with the government. I don't think that everybody is really being carried along. People believe the government is doing their own thing, I'm going to do my own thing. So it kind of leaves a lot to be desired. People aren't really following the instructions. Nobody really wants to sacrifice their own personal comforts or personal desires for a response that may or may not affect them.
What is the truth, especially the science that the practice of physical distancing prevents us from catching the virus?
Well, the fact is, if you don't come in contact with anybody, you're not going to get coronavirus. It's not going to spread. If you're sitting in your house, it's very unlikely that the virus is going to enter your house and affect you. So the truth is that if people, for a significant period of time, let's say 6 weeks, if everybody could, it's impossible, I'll put that caveat there, but if everybody could sit down at home for 6 weeks, the virus is unlikely to continue to propagate. It's the kind of thing that happened in New Zealand. They've actually eliminated coronavirus because they put very strict lockdown measures, and everybody was able to sit down at home and keep a significant distance, and by that they were able to eliminate person-to-person spread. So New Zealand is free of coronavirus. So it is possible, but it is not it's not likely in many places, especially in Nigeria.
Final 30 seconds to you, Dr. Okorobi, and that is your assessment of our report so far here in Nigeria.
Well, currently in Nigeria, I think the death rate still stands at about 3%, and with about nearly 5,000 people infected. I would say that the government is trying, but a lot more needs to be done in terms of, preparing the health system to handle the pandemic, which has always been my message to the government. If the numbers increase to 100,000 cases, are we still going to have, 3% mortality or even more mortalities in Nigeria? How is the health system prepared to handle the challenge in Nigeria?
Okay, let's
I would
quickly
say
get
that
Dr. Roja's last 30 seconds on this as well, especially with regards to helping our respiratory system, immune system against the virus.
Oof, now, there are many things that everybody's saying that can help and this and that. It's difficult to actually recommend anything because nothing has been proven to work. So the kind of things that would be comfortable recommending are, generally take care of yourself, eat eat fruits, and take good care of yourself. You can't really recommend anything specific. There's not really much we can say that will actually help the respiratory system to prevent coronavirus. But people that are at risk, they're the ones that should take the most serious social distancing measures, obese, hypertensive, diabetic especially, and those with other chronic conditions.
All right, we appreciate your time. Dr. Olakunle Roja, consultant, pulmonologist, respiratory physician, thank you for joining us. Also, Dr. Eson Okorobi, GP registrar in the UK, thank you for joining us.